Having grown up here, I had an idea of who was around. I think growing up, we probably went more years without dental insurance than with dental insurance. But through my National Health Service Corps scholarship that I had in dental school, where I was committed to providing care to underserved, underprivileged, underinsured, and uninsured individuals, and through my specialty, the children in Northeast Ohio, I had an idea of where our pockets of need existed.
So now, where do you see this going? Like, what's your future goals look like? Are you kind of good where you're at and everything's going well? Or are you planning on adding more doctors or more locations? Or how are you going? How do you see this kind of unfolding over the next, let's say, 3 years?
That's a really, really good question. The short answer is I have no idea.
Welcome to another episode of Dental Marketing Go. I'm your host, Gary Bird. I'm the CEO of SMC National, and we provide predictable new patient flow for offices just like yours. And today, I have the privilege of interviewing Dr. Kari, who is a pediatric dentist, and you are going to want to hear how she was able to be paid to build a blueprint to build her office. And I've never heard a story like this one before. It's very, very unique and a really good approach if you're struggling to figure out how should I build my new dental practice or should I jump into pediatric dentistry. You're going to want to hear this story, so stay tuned. All right, Dr. Kari. So you have shared something very unique with me, that you're in a position where you don't need a ton of marketing. You actually have all the new patients that you can handle. Could you kind of walk through how you found yourself in this position?
Oh, I will. I'll say, of course, it is always by the grace of God, but we were really blessed to literally take a phrase that I had heard years ago when I traveled overseas. I was in the Khayelitsha Township in Cape Town, South Africa, and one of the drivers who had taken us around said, when someone in our community makes it, they don't just leave to go and better themselves and broaden their horizons as an individual, but they return to the community that raised them. And really reinvest so that someone else in the community can have an opportunity to do so. So I was born in the greater Cleveland area.
Sorry to disrupt the show, but I got something crazy to share with you. We are attempting to connect with all of our listeners. We have thousands of people that listen to this podcast, and we want to meet you in person. We have 4 events coming up, and I want to give you a discount code that you can use for the next week to save $300 off your ticket. The discount code is Gary Bird, and the link is going to be just down below. You can also go to smcnational.com/events. I hope to connect with you in person and help each other grow our businesses. Can't wait to see you soon.
I grew up in the city of Euclid, graduated valedictorian from the Euclid High School in 2002, and traveled to Steeler Country from the Dog Pound, and went to college at the University of Pittsburgh, but then returned back home to the Cleveland area to go to dental school at Case Western Reserve University. And I also completed my residency in pediatric dentistry through the same university in partnership with University Hospitals Rainbow Babies and Children's Hospital. So to me, once a service commitment that I had through the National Health Service Corps was fulfilled, I literally returned back to my hometown and opened up a practice in the city of Euclid. So we really played up from a marketing standpoint. Hometown hero returns to reinvest in the community and really help other kiddos strive, dream big, and work toward achieving their goals.
That's awesome. And that's great. I love that perspective. I love that story. And I think that obviously resonates well with others in your community. So you are there a lot of other doctors who are kind of stepping into those shoes, or did you really step into a void that just other people weren't?
I think in the area, I definitely stepped into a void. Having grown up here, I had an idea of who was around. But at the same time, not that I think growing up, we probably went more years without dental insurance than with dental insurance. But through my National Health Service Corps scholarship that I had in dental school, where I was committed to providing care to underserved, underprivileged, underinsured, and uninsured individuals, and through my specialty, the children in Northeast Ohio, I had an idea of where our pockets of need existed. I began my service commitment in the city of Cleveland for a little over 2 years before I transitioned out of the county a little bit further west about an hour away from Cleveland, where I served as a dental director and a pediatric dentist at a community health center in Lorraine. So I knew, one, also needing to avoid a non-compete and restrictive covenant, that going out an hour away to then staying home, to come back home and set up a practice, was not going to put me in any sort of legal jeopardy with establishing a practice of my own. However, there was definitely a demographic search. I loved the idea and was very passionate about coming back home to provide care. And one of the things I like to say to our parents is that we're here to educate, motivate, and inspire. Years ago, I realized that children can't reach for what they can't see. So if they don't see someone who looks like them, establishing a practice, becoming a business owner, or even being a doctor, then I kind of really took on that load onto my shoulders. And I wear it proudly to be that sort of a face for children to potentially aspire or even consider dentistry as a future career for themselves.
So you stepped in, so you figured out, okay, how do I legally do this? Because you obviously had agreements that you couldn't open a dental office anywhere. But then you also stepped into somewhere where other people weren't willing or weren't aware that there was that need. And then, so what did that look like? Did you open up the office and you just had floods of patients? Or was it something that you had to work towards to get to the place where you don't really need marketing because you have enough new patients?
Right. It was a little bit of both. If you build it, they will come. There was not a pediatric dentist who accepted. The majority of my patients have state-funded insurance. So as I mentioned, with the National Health Service Corps scholarship commitment, that literally was not only a means to help pay for dental school, but also was a way for me to not have to worry about those financial commitments or those burdens to pay for my education, to allow me to still be able to treat this population in private practice. So I had my marketing consultant, who's also my sister. She was doing some phone calls, kind of cold calling some offices around the area and posing as if she was a mother moving to the area and would have state funded insurance, to then get an idea of who around town had this insurance, so that I wasn't potentially running into any roadblocks with establishing and having this duplicity of services so nearby to one another. So it really just turned out that in the building where we are located is 5 minutes from the home that we grew up in, and is definitely a staple in the Euclid community, very well-known building, and one of the few providers in, let's say, a 10-mile radius that actually accepts the gamut of state-funded insurances, and recognizing that there is a need. I remember growing up, and when we moved into our home in Euclid, we were actually the first Black family to move into the neighborhood. And that was almost four decades ago. And and now we're at a point where pretty much even the school system is majority African American. And so there's definitely a need. And there's a position that I chose to place myself in to really try to create the greatest impact that I can with this passion of serving these children who have this significant need.
So how long did it take to ramp up to where you're at now? Like, did it take a month? Did it take 6 months? Did it take from a new patient standpoint?
Sure. I did have patients on day one, which, this was a scratch startup. So I was quite a blessing. Luckily, there's so many folks. I'm the middle child, and my siblings we're all products of Euclid City Schools. And there's so many of our friends that we went to school with who have stayed in the Euclid area to raise their own families. So there was I was building up anticipation on social media. And we're sending out, text messages to family and friends, and really trying to work to identify those kiddos that we could put on the schedule around the time that we chose to open at the end of 2018. And I would say, there were lots of kinks that we needed to iron out. And I really had no idea what to look for in as far as a practice building. So in the beginning, I knew our first year, we needed to get as many butts in the chair as possible. And even still, I think it's been really probably about the past 2 years where I've really looked into doing what I call the State of the Panther Pride. It's a little monthly KPI, what has happened, updates, what are we still working on, what tasks are outstanding. And it's really helping our team members get a good pulse on what's happening with our practice. And when I realized after running these reports inside of our practice management software that we were averaging, in the beginning, there were about 50 new patients. Of course, so many folks are new. And now we're at a point where our goal is 105 new patients a month. And for the most part, we average about 95 so far. So we're
awesome.
And we're rocking and rolling.
Yeah. You're moving. So now you mentioned that you had a scholarship that's one of the reasons that you moved back. First of all, obviously I know what a scholarship is, but I'm not aware of the kind of scholarship that you had. Was it set? Could you explain that to us? Like how that was set up and how that really impacted your decision to go where you're at?
Sure. So this is the National Health Service Corps. It is through the Department of Health and Human Services, through the government, the Department of Human Resources and Services Administration, or HRSA. And what this is, it is a scholarship. They also have loan repayment programs. So individuals who might not receive the scholarship during their years in dental school may look at the National Health Service Corps loan repayment program as a means to help receive funds to pay back their student loans. I was one who had an interest in serving the underserved populations from the get-go. And really that semester at sea program that I had done in college really helped shape my desire to serve underserved populations. So this scholarship program does just that. If you receive scholarship funds, it can be up to 80% or more of your dental school tuition and fees that are paid for. But there's a commitment to serve in what's called a federally qualified health profession shortage area, or a HPSA is the other. No, there's so many acronyms when you're dealing with government and dentistry, to be honest. So if you're part of a HPSA, then, and this is really identifying that there's a great need when they're looking at population density and the different types of providers that are available, and through all sorts of whatever math and that algorithm that they utilize, there's a score, and the higher the score, the greater the need. So for scholarship recipients who are part of this program, we are committed to going to the areas of greatest need, where maybe the threshold might be, say, a score of 20 out of a score higher than that. Whereas an individual who receives loan repayment funds may very well be able to go to a place that has a health profession shortage area score of maybe a 12 and then on up. I was excited and blessed that at least that there were health profession shortage areas and a number of community health centers in the greater Cleveland area through which I could fulfill my service commitment. But they just had, not many of them get specialists that are interested in a position. So that was another hurdle that we had to overcome in helping these entities realize that there are children who could benefit from a specialist service as a part of this program. So then I had that blessing of finding a community health center network that accepted me and all that I came with. But then we needed to establish pediatric services that they had never had in their, at the time, 45 years of existence. So having that, I feel like everything, again, it's just the Lord ordering my steps, being in that role, coming out of residency as a specialist, and needing to set up 2 pediatric dental clinics for this community health center network. I started laying the foundation that when it ever came time for me to establish a practice of my own, I had already been through it before.
You already had the blueprint. So you were paid to figure out a blueprint for yourself.
There you go.
That's really good. That's awesome. That's the best way to do it. And so now, where do you see this going? Like, what's your future goals look like? Are you kind of good where you're at and everything's going well? Or are you planning on adding more doctors or more locations? Or how are you going? How do you see this kind of unfolding over the next, let's say, 3 years?
That's a really, really good question. The short answer is I have no idea. I've had some
that makes me feel good.
that we're working to come to fruition. And I thought for a period of time that I really needed another doctor in the office to make some of these initial dreams come true. I gave it a try. I also recall those days in dental school in which they say 90+% of the first associateships, they don't work and they don't end up turning into long-term opportunities. I can attest to that. The first associate that I hired, we are no longer together. And But what the Lord did at the same time was to give me the confidence that I needed in myself, that whereas I thought I needed another person to help make these other programs I was wanting to do come to fruition, I actually did not. And in that same time frame where my associate and I were parting ways, a school-based oral health program that I call SBOP, that we had a dream of, I had wanted to kickstart it, and then COVID happened. And you can't do school-based oral health if schools are closed because of the coronavirus. So it was set on the back burner for a little bit, only just while we waited and really ironed out our paperwork, ironed out who we were going to seek contracts with. And we were able to roll it out last summer into early childhood learning facilities and daycares, because they don't close during the summertime, and really allow us to kind of pilot this program. And then now that the school year is back and we've gone to elementary schools, we've got a few contracts with some Head Start facilities, and things are just rocking and rolling. And we have a nice pace, a nice varied schedule between in-office with children who are wide awake. We do in-office general anesthesia services, so we have those days where it's a little more quiet while we're able to provide comprehensive care to children under general anesthesia. It's a beautiful thing to be able to provide that care. Again,
my kids, I always tell everybody, my kids are very well behaved while they're sleeping.
Absolutely. I love it. And then to be able to, again, shake things up, and we're taking dentistry to the children's school. It's a non-invasive diagnostic and preventive visit. We are not taking radiographs, so we'll do comprehensive exams. We'll clean the teeth. We'll place fluoride. We even have the mobile unit where we can do sealants. And it's just to be able to provide this service, and for a lot of these children, their first dental experience, and increase that access to care while minimizing parents' need to be out of work. And we'll place silver diamine fluoride where we see cavities brewing on primary teeth, and follow up. We have a great follow-up program in which we're able to identify those children and call them back to see us in the office. Some may then very well qualify for our general anesthesia services, but others might have a few fillings, or, once we're able to take those x-rays when they come in, that we can treat while they're wide awake.
That's so cool. So first of all, thank you so much for coming on today and sharing this, because I know initially you were like, well, I know this about marketing, and I don't do a ton of marketing, but I think the thing that's so powerful about this is that I try to talk to as many different people about how did you grow your offices, and everybody has a little bit of a different story, right? Mm-hmm. So you have a very, very unique story. And what this shows is that you can go and build a practice, and you don't have to use an exact blueprint that somebody else is using. You can do it on your terms in the way that you want to do it. So you had a very specific mission in mind, and all the pieces came together for you to make it work, and not just work, but work successfully, and have a clear vision for, the future. I know we don't know exactly what's going to happen, but you laid out some roadmaps there that if those things continue to move forward, it's going to have impact for you. So let me ask you this last question. You have a bunch of dental students sitting in a room, and they have no idea what they want to do, right? They don't know if they're going to go work for a DSO, start their own practice. They don't know which direction they're going to go. You have them all sitting there listening, and the topic that they want to hear about is new patient growth. What would be your one message to them to stay focused on?
Oh, I like that. It'll be create a memorable experience for your patients so that they tell a friend who will ultimately bring a friend. And at the same time, as a specialist, a lot of my patients will come from other practitioners. So creating a unique and memorable way for other providers to think of your practice as the go-to and staying relevant in their space. So that would be the short message. And I'm sure someone would say, ooh, but Dr. Kari, how do you do that? And I'd say, great question. What we do, not only do I love acronyms, and as much as I say, it's so written in governmental things and in dentistry, we provide service with a smile. And for us here at Panther Pediatric Dentistry, a smile stands for superior customer service, medically necessary care, integrity, leadership, and education. And I have a big poster of that'll be out in the waiting area. I'm just waiting for a couple of other frames to come in, but I have it. It's on our website, and so it's very front and center and part of the pillars upon which this practice was built. And there's that to provide just a quality experience for the children and their parents, welcoming them, making them feel like they're part of the family. So for us, our family is our pride, a pride of Panthers. And so we really just say, welcome to the Panther Pride, and really create this very homey, excellent, top-notch experience that they'll have. I also do recognize that I can't treat every kid who walks in here. Not every parent jives with our philosophies and our practice policies, and I get it. And for those individuals, I let them know we are not the only folks in town. They're very welcome to seek another opinion or to seek comprehensive care from another practitioner. But for my general dentist and my orthodontist and my pediatricians, we make sure we stay relevant with some sort of a quarterly marketing activity. We do something fun. I have a woman in Pittsburgh where I went to college, University of Pittsburgh, hail to Pitt. Also, blue and gold Pitt Panthers. Euclid High School are the blue and gold Euclid Panthers. And so that's why we're located in Euclid and we're called Panther Pediatric Dentistry, because I simply can't hide that Panther pride. But we do something fun. She makes soap. She makes candles. So we did birthday candles for our 4th birthday in November to pass those out. And we have little recommendation cards for newborn and infant oral health care, infant and toddler oral health care, and school-age children oral health care that we give to the practices. So when they have a child that they're wanting to refer or that they're constantly thinking of, there's a kid here, let me go ahead before I get beyond my capabilities, let me go ahead and send over to Dr. Kari. Or if there's a child who's there for orthodontic consultation and they don't have a dental home, then I really appreciate the reciprocal relationship we have with our orthodontic colleagues. And of course, for my pediatricians out there, the American Academy of Pediatric Dentistry really wants that dental home to be established by the 1st birthday. So when kiddos are coming in for their well child check, and the pediatricians are getting more and more on board with understanding that. And I want to see those itty bitties. I want to see them 1st birthday equals 1st dental visit. Come in, let's talk about how to obtain and maintain a healthy smile for life and establish those relationships very early on for the kiddos.
That's so cool. Well, thank you so much for coming on. Thank you for sharing your unique journey and just being transparent about the goods and the bads and the hards and the easy. Some very, very good takeaways here for those that are going to be listening, especially those that maybe haven't started yet on the other options that you can go down, the other roads that you can go down. So thanks so much for coming on and giving us the background.
Great. Thank you so very much for having me. I appreciate it.